Thank you, Jason. Good morning, distinguished panelists. Thank you for taking time from your busy schedule to join us in this Let's Chat session today. But before I begin, I know there is a poll around what the headlines that everybody like to see in 10 years' time. Like to see what some of the results from this poll. Okay, so it looks like the top voted headline is Pop Health approach allows Singapore to keep its healthcare manpower sustainable despite constraint. So maybe to kick this off, I'd like to ask PS Yankit, what do you think of the headline, and also to give its perspective of why population health and why now? Why population health is so important and why now? PS?
Thank you very much, Leong Sing. Actually, in fact, the number one item on the poll, I think precisely reinforces why we need population health. There are two areas that we have been quite concerned about. One is, of course, the escalating cost of healthcare with an aging population. The other, even if we put a lot more budget into healthcare, can we find the people to provide healthcare, whether it's healthcare professionals, allied health professionals, and the supporting staff. If I can take this maybe half a step back, when you look at population health, it's the next big step in a transformation journey that we have taken for the last at least 2 decades or so. We started off the transformation of Singapore healthcare probably about 20 years plus when we transformed the healthcare sector by corporatizing our healthcare institutions into 2 clusters. And then over the last 20 years, as we look at the challenges we have over the horizon, we make adjustments. So in the last few years, colleagues in the healthcare sector would know that we have had these 3 beyonds. We were looking at beyond healthcare to health, beyond hospitals to community, beyond beyond quality to value. And we also set up things like regional health systems, for example. And the main purpose of doing all this is to see how we can provide better healthcare for the population. So when you look at the efforts that we have made in the last several years, we had gone beyond looking at episodes in the acute hospitals, for example, to looking at bundles and looking at how the hospitals can work better, the acute hospitals can work better with community hospitals, how we can have more seamless integration across these different segments. But that is only looking at different segments. So the next big step really is a natural step as well. When we look at population health, we are really looking at cradle to grave. In fact, pre-cradle, if I may say, we look at prenatal care, prenatal screening, for example, and all the way to ultimately all of us will die. But how can we make palliative care more effective and better? And most importantly, looking at the whole spectrum. So this is one big area that we are looking at, primarily to try to address the issue of rising cost of healthcare as the population ages. But importantly, as the poll indicates, we also need to right-side care and to look at how we can optimize the whole spectrum better, so that the healthcare professionals that we have, the allied health professionals we have, can better focus on care outcomes, and then at the individual's level, how to empower the individual so that overall we have a much better system.
Thank you, VS. Yeah, so I think perhaps this is also a good segue to talk about the importance of telehealth and also the engagement with the private care sector, such as the GPs. And I think just now one of the keynote speaker, John Halamka, also talked about the importance of telehealth. So perhaps maybe I would like to switch over to Prof. Tan, who has joined us online. Prof. Tan, you lead the Pop Health track on telehealth and GPs. Perhaps you can share with us a bit of your views on why is telehealth important, and how do we leverage on telehealth to support our Pop Health effort? Prof. Tan?
Yeah, thanks very much, Leong Sing. When we think about telehealth, we often think in terms of service delivery. In other words, instead of providing in-person care, we provide it through telehealth means. And this is a very important concept. It is also particularly salient in the COVID-19 pandemic, when we are also trying to reduce unnecessary physical attendances at healthcare facilities. But in the spirit of population health, we have to think beyond changes in service delivery. And there are two important dimensions I wanted just to highlight. The first is that whether it is a patient who wishes to improve the control of their chronic disease like hypertension or diabetes, or it is someone who is trying to stay well to prevent the development of diseases, what is really critical is the change in behavior of the individual and the adherence to the treatment regimes. And this is best effected if the individual is supported by a care team, supported by technology through telehealth. So this is one important dimension which will be increasingly critical for the future. One quick example of this is the telehealth program that we have for hypertension that is being rolled out with the cooperation of all three polyclinic groups in the clusters and the MOHT. And another example is the Lumi Health program between Apple and Health Promotion Board. I mean, both of these are examples of how we want to enable individuals to change their behavior in a sustained manner. And this is also recognizing that because of the increasing prevalence of chronic diseases, we need to have a sustained engagement and support of the care team that will enable much better outcomes to be achieved by the patient over the long term. And so a really critical part of telehealth is to improve the long-term outcomes of control of hypertension, diabetes, hypercholesterolemia, and other chronic diseases. And this in turn will lead to reduced incidence of severe complications arising from such conditions. So if you're able to do this well, then it would reduce the burden of severe complications arising from chronic diseases for the healthcare system in the future. Thanks.
Thank you, Prof. Tan, for a very insightful view into how telehealth can be really leveraged to support population health. Perhaps now I switch gear a bit to talk about, just now we mentioned about the role of the primary care providers. And I'd like to now turn my attention to Dr. Tam to hear a bit of his perspective from both a practitioner as well as a private provider. What he sees are some of the challenges that the GPs will face in support of population health. Dr. Tam?
Thank you for the question. For the benefit of our international audience, maybe I just want to briefly describe how our primary care structure is like in Singapore. We have, of course, at the one end, the public polyclinic system, which is in effect a large multidisciplinary medical centers practicing in the community. We also have on the other end of the spectrum, small private sector GP practices. These are typically staffed by 1 or 2 doctors with a handful of supporting staff. In the context of population health, I can see a few challenges that we have to grapple with in the coming years as we look into this area. Firstly, of course, is the fact that when it comes to IT systems, many of the small GP practices, they tend to have underdeveloped IT systems. Now, I'm saying this more as a description of what is happening on the ground. I'm very mindful that this sector is very heterogeneous. We mustn't overgeneralize. But the fact of the matter is that there has been many observations on the ground. For example, if a GP clinic were to refer a patient to, let's say, a specialist clinic or any other healthcare provider, the mode of communication could well be a hard copy referral letter. It could well be through fax. And this is a reflection of the current state. And obviously, this will provide challenges for us in the context of population health in future. The other challenge that I think that is very important to mention as well is that not only are the IT systems underdeveloped, there is a tendency to be siloed. And in that regard, it means that the primary care providers don't really communicate easily via their current IT platforms. And primary care providers have difficulty communicating with other healthcare providers in the ecosystem. Now, again, from a population health perspective, this is going to impede some of the shared care initiatives and collaboration. Following that, of course, is the fact that in many instances, data tends to be one way. You may have GPs contributing data to MOH and national systems, partly because there's a need to submit data for claims, there's a need to submit data for verifications of the schemes, etc. But these are more like an administrative kind of submission. And there isn't a one way back to the GPs, for example, in terms of through a primary care dashboard, where they can provide actionable insights. And when it comes to the physicians taking care of the patients, I think one would appreciate that generally we would like to have actionable insights to help us intervene and manage our patients better. Very often the data that we get back could well be just something related to administrative data that reflects the schemes that we are participating in, the claims that we are making, and these are not clinically useful in that regard. Now, in the sector today, the GP clinics IT system tends to be procured from various private sector entities. Many of these private sector entities, we call them the clinic management software vendors. They have electronic medical record systems in place as well. But unfortunately, they tend to be fragmented. They don't tend to connect with MOH and the various national systems to a large extent. All right, there are, of course, exceptions. But because of this kind of a scenario, we are in a situation whereby even if we want to collaborate in population health initiatives, if we want to, for example, work with other healthcare players in the ecosystem to take better care of the patients, there is a lot of obstacles. We are also very mindful that in Singapore, the patient is likely to access care from more than one point. Okay? Today, they may be seeing a GP. Tomorrow, they may need to go to the emergency services. In the next month, they may need to touch base with another community care provider. And if the information doesn't flow seamlessly and is not shared, one can expect quite a lot of difficulty in ensuring that there's holistic care delivered to the patients ultimately. Thank you.
Thank you, Dr. Tham. Yeah, what you just mentioned, I think, remind me of what Minister Masagos mentioned, at least two of the beyonds, about beyond one-way exchange to two-way, and as well as also from connectivity to continuity of care, which is actually what very important when we engage the primary care providers in this effort of the Port Health. So perhaps now I would like to turn the attention to data and health technology. I'd like to ask DS Siu-Ying, who is also the CEO designate of IHiS, how do you see technology playing a role in supporting population health? DS?
Thanks very much, Leong Sing, and very good morning to everyone. How do we see technology playing a role in population health? I think several speakers this morning have spoken on this topic. But maybe let me share my thoughts on this from in my own words. I really see that we can use technology in at least three ways, and let me talk about the three. The first is with integrating care across care providers. We've just heard Dr. Tham talk about the primary care networks and the primary care working in a relatively fragmented way. For population health to really work, it involves the cooperation and collaboration across multiple care providers across the health and social space. With technology, it enables us to integrate that care, where for the individual, there's a singular care plan that follows that individual regardless of number of points of interactions he has with either a healthcare provider, a social care provider. And technology allows us to do that seamlessly, interoperability, and in a way that is very easily scalable very quickly. The second area where I see technology really making a difference with population health is with the interactions with the individual, whether it's a patient or a citizen. For population health to work, actually the individuals need to be taking charge of their healthcare, taking charge of their own health, not just healthcare. The individuals and the families need to think about behavioral changes that improve their health, thinking about monitoring their own health conditions, thinking about what they can do differently to prevent some conditions later on. And in order to do that, actually, it's really technology has a capacity to put information in people's hands, right? You can trigger people to remind people to eat healthy, to get your rest, sleep, go and exercise. You can remind them of the appointments for their screening sessions or their follow-up appointments for their chronic diseases. It helps us bring information into people's hands seamlessly and quickly, well beyond the traditional way of making phone calls and face-to-face interactions. We talk a lot about two-way interaction between providers and the patients as well, and technology allows that to happen. We're already seeing through COVID a lot more use of video conferencing, teleconsults, and that has enabled care to continue even during the pandemic. And there's a lot of other ways to use technology also with remote sensing, vital signs monitoring, where the provider does not actually have to see the patient in order to understand the patient's situation and to be able to best prescribe or intervene to make sure that the patient is supported. So that interaction with the individual or the patient is really something that the technology space has a lot of potential to innovate in. The third area, and several speakers have touched on this today as well, is with using advanced analytics to better target support for Singaporeans and patients. Bruce mentioned it in his speech as well, that we are already using AI to better predict which are the higher risk patients as we seek to support the hospital to home programs. We also are able to better predict who are the individuals who are more likely to be readmitted down the road and be able to target our interventions in those areas. So there's tremendous opportunity for us to use big data in a very different way, very innovative ways in this area. And I can see it being applied in improving decision support, helping the clinicians with interventions based on what the data is saying. Also, as we try to reach out to the entire population with population health, we want to be able to target our resources in the right way. So big data gives us an opportunity to use machine learning, use AI to be able to better predict who are the people who are about to, or are just a step away from bad health, and be able to make sure that interventions happen there. So tremendous opportunity to use advanced analytics to be able to bring predictive insights into this space. So I think for population health, it's really an area where technology and innovation is really something that's ripe for this time. There's tremendous potential, and we should really leverage on how we can bring about new technology and apply that to the population health use case to really bring about better population, better healthcare, and better health for Singaporeans. Thanks.
Thank you, DSU. Yeah, as a technologist myself, I do also think that the various pieces are there. And now is how do we make them come together and better integrate to really deliver the kind of outcome that we want to get to. But I've been also reminded by the organizer that there's a word cloud being generated from so perhaps we want to see what is the outcome of the word cloud that has been used from the terms that's been that we have so far. So it looks like some of the key things like care at home program, common IT platform to support different care models, behavioral science and nudging the unmotivated, funding for population health, improve care coordination across different providers. So these are some of the key words that I think got highlighted throughout the session so far. So I think it's also now I'd like to switch to PS again, to ask PS about what you think are some of the outcomes that we'd like to see from a ministry perspective in the next 5 to 10 years.
Right,
Yeah.
Thanks, Yong Sing. I must say that I'm quite heartened when I look at the poll results earlier and look at the word cloud results. Many of the priorities, I think that the participants have indicated very much align with what the ministry is thinking of. So if I look at the outcomes, early on from the poll results, the two most important outcomes for the ministry ultimately must be better health outcomes for the individuals at the individual level, at the population level. Second, of course, I mentioned earlier on about resourcing, whether it's in terms of budgets and how much individuals have to pay out of pocket, or in terms of healthcare resources like manpower resources, how to optimize this such that we go back to the first outcome, which is provide the best care for the individual. Priorities-wise, actually, both Dr. Tam as well as Xuing had alluded to some of these areas. I would say there are three priorities in the short to medium term. First priority is we are looking at, for one better word, a whole of sector approach. How do we get the whole sector centered around the individual to provide that healthcare outcome that we're looking for? That means that we need to have better integration, more seamless integration from primary care to acute care. So our primary care partners, so as Dr. Tam pointed out, we have a very diverse GP, general practitioners group out there. How can they be better plugged into what the acute care and community care partners are doing? Then at the other end of the spectrum, of course, you have the community care partners. Again, how can they be more seamlessly integrated with the acute care? And overall, when we look at the whole spectrum, then how do we right-side and go a bit more upstream? It's always easier to manage a disease, for example, especially chronic disease, when it's still in the initial stages. It can be done at much better at the primary care level. By the time you have to go to acute hospital, actually, there isn't that much that can be done already. We can, of course, provide very good care for the patient, but much better outcomes, and of course, much cheaper outcomes if you can move it upstream. So this seamless integration is important. Of course, beyond the healthcare partners, we have social community partners as well. There are a lot of things that the community can do, the social enterprises can do, which can help the individual look at preventive health. So these are different pieces. I look at it as a whole of society, whole of sector approach centered around the individual. So that's the first piece about integration. Second piece, of course, is the systems must be there. So Dr. Tam mentioned earlier on, our GPs are, some of them are very IT enabled. Some others are still using good old, I call it Mark I technology, paper and pen. And then when you have a referral, it's just a medical letter handed over to a patient goes to another clinic. But when that happens, a lot of the information about the patient actually is not shared, it's not known. So how do we have a system, especially using IT and technology, that allows better integration of information, of knowledge, of the patient's background? Other parts of systems are important as well. So one area which the ministry is looking at, of course, when we look at subsidy, subvention, how we can make healthcare more affordable, where do we best place the limited budgets that we have that can provide those incentives for the individual to look after his own health, for the right sizing of care. So there's a whole spectrum that we are looking at. Last, and I would say the most important priority we have is how do we empower the individual. Ultimately, if the individual doesn't do anything, he waits until the last minute when it's almost nothing much that can be done, then he turns up at the A&E of a hospital. Very little that we can do at that stage really. But if you can empower him, if the individual knows what he can do himself or herself to remain healthy, maintain a healthy lifestyle, and whether it's about eating better, exercising, etc., all of these things, we put information in the hands of the individual, he understands it, he's better able to change his lifestyle behaviors so that ultimately the health outcome is better. So there are three priorities. In the next few years, we are working on all three. We hope that by doing this and together with the collaboration and efforts of all our partners, we would achieve our goal of ultimately a better health outcomes for the individuals in time to come. Thank you.
Thank you, PS. Yeah, indeed, I think taking a sector-wide approach and right-sizing the care, strengthening the primary care and the community care is really the next phase. And perhaps now I'd like to hear a bit from Prof. Tan, who is online. What you think are some of the things that we can do to empower both the primary care and maybe even the community care providers in support of pop health? What are the things that you think we should be doing to support that? Prof. Tan?
Thanks, Long Sing. So I think we have had a very clear explanation from fellow speakers about the rationale, the directions. The question is, how do we try to get it done? What are the steps needed to implement this effectively? I think of it in three broad categories. The first is the clinical and care model. And the clinical and care model really revolves around how, as PS and Kit said, we organize the services around patients and their needs. And for that, we do need clinical protocols. We need coordination between different service providers, whether in hospitals or in the community, in order to deliver those support and services to patients. So there's a great deal of work that we can do, and which has started in developing the care and clinical models. Then I think the second important piece, which DS Ewing pointed to, is the data enablement. Because at the end of the day, data is the lifeblood of integrated service provisioning. And there are many impediments to the two-way, smooth and secure sharing of data in ways that enable care to move from a more provider-centric point of view to a patient-centric point of view. In other words, today we largely organize service provision around providers, whether hospitals, clinics, or service providers in the community. We need that data together with new care delivery models to organize the services to meet the patient's needs, as opposed to organize around the provider type of service provisioning. And I think the third piece, which is really critical, is the financing, alignment of financing incentives. So from the patient's point of view, patients have to see the value of this new way, this new approach of care being delivered in a more seamless manner to them, and for them to participate much more actively in their own care and in prevention of severe disease. So patients have to see the value in this, and it has to be easy for them to do so, particularly if you are using telehealth types of technologies. In the case of the hypertension telehealth project that we've been working on, it was very important that we reduce the telehealth component to 3 simple steps, which even people who are more senior, people in the 80s are able to use very easily. So the patients have to see the value. It's got to be made easy for them. In the same way, we have to make it easy for the providers, whether they're GPs or hospitals or polyclinics, to come together to deliver care in a much more coordinated manner. And so that's where the IT, the data flows, the financing incentives have to play a really critical enabling role, so that it's easy and that providers are also incentivized and recognized for providing care in a much more integrated manner. So as PS and Kit said, the great opportunities for us now to bring all these different elements together in a well-coordinated manner. And I believe that this is something that we are making strong progress in, and that by so doing, we'll be able to reach the ultimate goals of population health. Thanks.
Thank you, Prof. Tan. Yeah, indeed, I think the key here really is organizing the service around the patients. And I think I'd like to now ask Dr. Tam, what you think as a private care providers, what are some of the top priorities that you see that GPs will need to do in order to get yourself ready in support of this effort? Dr. Tam?
Thank you for the question. Previous speakers have briefly mentioned the importance of patient-centricity as well as the appropriate and good clinical care models. Perhaps in order to answer this question better, I just thought maybe we should share a little bit of what are the wish lists that a typical small GP practice may want to request. Firstly, I think in the context of data, I think we want to make sure that there is appropriate sharing of clinical data. I don't think GPs, as part of this ecosystem, should practice in isolation. I think today the challenge is compounded by the fact that data is not just being produced during the consultation process. Data is being produced via remote monitoring. It could be via various patient inputs through apps. And all these have the potential to contribute a very rich network of data for the clinicians, especially with actionable insights to see how they can review their care and add value to the care of the patients. The second thing that's very closely related to the first point is that we do want to have shared outcomes data. And this is important in the context of if we want to look at quality improvement of care within the ecosystem. We want to look at governance. If you want to look at whether the shared care collaborations has produced the kind of desired outcomes that we have envisaged upon. In this regard, I think much needs to be done because we are still quite siloed and not properly integrated. Thirdly, I think many GP practices, because they are small entities in themselves, they would also want to share various types of admin data that can help them to deploy and function more efficiently. From an operations perspective, of course, we would like to have access to appointment systems, referral systems. We want to have access to integrated claim system and submission systems. And all this ensures that whatever programs that we roll out within the ecosystem, in the context of population health, we are kept abreast of what is happening within the various touch points, and certainly where the patients are cited and where the patients are receiving their care. The other area which I think is of concern is the fact that when it comes to cybersecurity protocols, when it comes to IT governance, GP entities being small business units may not be at the same level as our public healthcare institutions or the bigger entities. And I think it is worrisome if you look at some of the global and local trends when it comes to some of the IT security issues that happen from time to time. I think in this regard, the GP practices do need support and do need guidance as well as help. And I would say that it is important that they work well, collaborate and consult MOH as well as various national agencies, how they can prepare themselves better in order to make sure that this is a plug, the gap that they need to plug. In addition, I think we have currently in the sector a situation whereby while we have procured our IT systems from various type vendors, okay, as I mentioned earlier, because we are not exactly integrated with MOH and national systems, it is important to keep a lookout for any solutions that can help us integrate better. I'm very heartened to hear from the earlier speakers that actually the solutions are there, even though on paper the IT systems appear siloed, but it's just a question of how we want to integrate them with the appropriate solutions. So in summary, I think it's important for us to really define the kind of care, the kind of role that the primary care sector is going to play in this population health journey, and let, in the words of Bruce Liang, what he has said earlier, let the techies come up with the solutions to support what we intend to do. Thank you.
Thank you, Dr. Tam. Yeah, indeed, I agree with you that actually data is now being generated everywhere in all care settings, and it's more important now to really share and interoperate. So perhaps I'd like to hear from DS Ewing. How do we balance now between interoperability and at the same time to prevent fragmentation? As we all know, when you fragment more, it's always harder to interoperate and integrate as well. Ewing?
Yep. Thanks very much, Long Sing. That's a very, very good question. How do we go fast without causing a huge mess at the end? Right. So I think there are a few elements that need to be in play in order for us to be able to move fast. Firstly, I think we need strong engineering foundations. And Bruce has talked about this a little bit in his earlier speech. I think there needs to be a strong system of records where the data sources and definitions are very clear. Together with the system of records, I think we need sort of a services integration layer so that applications can interoperate with each other and access the data as it needs. And this forms a very good and strong foundation upon which the second element comes in, where we have an applications layer that is sort of responsive and evolves as the care needs evolves. And here's where there's a lot of opportunity where the technology and the business needs to work and sit very closely together. The technology needs to understand what the business needs, what are the care models, what are the services that are required, how do we intend to integrate care, how's the patient intending to move across providers, how do we wrap the care around them. And the applications and the solutions on this layer need to be flexible, need to be, in a sense, in many cases, localized and customizable. Because different parties would have different care models or different ideas in mind on how to outreach and interact with their patients and the population that they're to serve. So a very responsive and interactive application layer sitting on top of strong engineering foundations of data and services and common services would be the way that we can go fast. The third element is also that we have to make use of cloud infrastructure. I think cloud is the way where we can scale and grow quickly. And that's really something that is needed when we look at population health. So IHiS has been building off the health IT master plan over the years and has put in place different platforms and services that can now be deployed as we try to achieve the population health vision. And amongst that is also the move and development towards hybrid cloud infrastructure, which I think will serve us very well as we try to move quickly in this space. And fourth, and probably just as important, is this idea of partnerships. I think the needs in the healthcare space are so wide. They really span across a very, very broad breadth. And there are technical capabilities and skill sets that are available across the technology landscape. In order to move fast and provide the technology and data support needed for population health, we need to grow our own native capability to keep up and to provide that support. But I think we should also reach across and work with the partners that are all across our ecosystem and leverage on the competencies that complement what the native capabilities are. And this is working with technology companies that are here and abroad, working with educational institutions, research institutions, engineering teams, so that we can quickly prototype, test, scale, productize, and then adopt the different solutions that can work together to fulfill this phase. So working with partners will also allow us to move quickly. I liken this really to a football match. Once the stadium is in place, the pitch is laid, we've drawn the lines, we've marked out where the lines are, we are clear what the rules of the game is. Then the different teams can really deploy the tactics, the strategies, bring in the talent that's needed to achieve the goals that they seek to achieve. And in this way, with the clear stadium marked out, I think the teams can be able to work fast, work with people that they are familiar with, work with the capabilities that are out there. And in the end, it comes together in a coherent way. We can coalesce around a common mission, and we have proper services and data that interoperate and integrate with each other. So I think that's the vision that we should have to be able to move quickly, rapidly, and in a coherent manner in this space.
Thank you, DS Ewing. Yeah, perhaps next I would like to take the next 15-20 minutes to look at some of the questions that's actually being posed on the chat online. There's one that's actually directed at PS Yankit, but I thought this one, even DS Ewing probably can give a bit of your inputs as well. It was saying that, what do you think is a differentiating factor that makes IHiS unique to support population health? PS?
Well, first of all, excuse me. First of all, for IHiS, it has been our healthcare IT partner for ever since it was set up about 5 years ago. Even before that, set up in the current form. Before that, IHiS existed as well. We had MOH IT and IT division. We amalgamated it. I would say that I'm relatively new to the healthcare sector. I was posted in less than 2 years ago. I must say that the healthcare sector is a very diverse sector. The kind of domain knowledge needed actually is non-trivial. So when I look at IHiS, I look at the many IT companies that are out in the IT industry. One advantage IHiS has is that it has been plugged in from day one. It's very closely integrated with the public healthcare sector. In fact, it is one of the subsidiary companies of MOH Holdings, as are all the other 3 clusters. So everything that IHiS does, what it briefs, what it does, is all about healthcare. Very rarely you find such an entity. Certainly not in Singapore. Singapore, most of the other IT companies that are of similar size are fairly diverse ones, your SIs, your system integrators, and so on. So IHiS is very focused. I think that gives it an advantage. It has been working with our public healthcare leaders for many years as well, and that kind of understanding, both at the operation level as well as at the leadership level, I think is paramount. But of course, that said, from the ministry's point of view, if we have strong partners we can work with in the IT industry, that's something which we certainly welcome. And I'm also one. I have another hat that I wear, which is in the IT promotional area. The more partners we can grow in the rest of the IT industry, I think it helps to make the ecosystem stronger as well. IHiS, while it's very focused, it cannot do everything. Even today, it relies on partners in the IT industry for many of the projects that we have. So ultimately, my own take on this is that IHiS ought to be and is today the strategic partner of the healthcare sector, but it cannot work alone. It must work together with and tap on the strengths of the larger industry. And that's where I think we can have the best of both worlds, bring the strengths of everyone together to serve the IT industry.
Yeah.
Sorry, to serve the healthcare sector.
Yeah. Indeed, I agree. It's almost like the network effect, right, of the internet, and how you leverage really on the strength of the other partners in order to really further strengthen. Maybe DS Ewing, as the incoming CEO designate, maybe you can share a bit of where you think are some of the key roles and areas that IHiS is unique and can really play a key role here in population health. Yeah.
Yeah, very happy to take this question, and I fully agree with what PS Yankit said about the position that IHiS is in. The way I see it, IHiS sits at the confluence of health and technology, and therefore we are the health tech company. IHiS has a team that has worked in this healthcare space, worked as partners of the public healthcare institutions for many years. The teams work alongside its partners to understand the business, and they take the approach to treat it like we own it. Right, the problems or the requirements, the needs of the public healthcare institutions are the challenges that IHiS works together as a team to be able to meet. And when our users speak of patient safety, regulations, improving the patient experience, improving the clinician, healthcare worker, nurses experience, making sure that we have adaptable care models, IHiS understands that. And IHiS takes it as a challenge to figure out ways, find technology, find data, find solutions to be able to support the healthcare partners in those needs. So IHiS understands the healthcare space and has been in this space for a while. IHiS also understands the tech. We have a large team of engineers and specialists with very deep technical capabilities. Our team spend the days looking at technology and looking at how it can help to fulfill what its partners need. It also looks at the technology horizon to see what's coming, what's new, and seeing whether that we can think about it in a different way, think about it creatively, and deploy new technology to serve the needs of the healthcare space today and also in the future. So in a way, IHiS sits at that confluence, that very unique confluence of being very familiar with healthcare, being very familiar with technology, and are therefore the health tech partner for healthcare today. Minister Masagos and Bruce mentioned a few examples earlier in their speeches about how IHiS was able to respond during COVID. And that to me is really an example of how when health and tech collide and meet, and where there's a meeting of minds, there's a public service mission, there's a clear objective, a lot of good can come out of it. Through the COVID pandemic, the IHiS teams were really on the ground, working alongside the healthcare workers, even in the red zones, looking at what was needed, following the care processes, and then quickly deploying technical solutions. And along the way, they enhanced it to a point that it was able to support what the healthcare and the different facilities that we had to set up very quickly, and they were able to do it with very extremely short turnaround times. So that to me shows really the depth of technical capability, the expanse of the skills and the tool sets that IHiS has already in its arsenal to be able to deploy for such purposes. So I really find this is an exciting time for IHiS, not just for today and to meet today's needs, but also to look into the future. And I think the future is here already. We have been talking about population health, talking about how to improve health for our population and individuals and for Singaporeans. I think there's a lot of opportunity to marry health and technology together and look at leapfrogging capabilities, look at bringing technology, both new and current, into the play to be able to best support our population health objectives and best support our healthcare providers in achieving their mission as well. And to us, I think IHiS treats it like we own it. It's our challenges to solve, and we solve it together as a team.
Thank you, Siri. Yeah, I certainly look forward to seeing IHiS playing a critical role in enabling this mission, this sector-wide mission of population health. The other question that is high up on the list, upvoted, is actually relating to GPs. So this one probably I would like to hear a bit more from Prof. Tan as well as from Dr. Tam regarding the question is, what can GPs do to step up beyond clinical care? Whereas I start with Prof. Tan first, coming from as a lead for the GP track in the Pop Health work stream. Prof. Tan?
Yeah, thanks. I think that's a very important question. And there are a couple of dimensions I think worth thinking about. The first is really about the scope of primary care. So whether we are a GP or a polyclinic, what should the scope of primary care be? And I think it definitely has to go beyond the management of acute illnesses like diarrhea or respiratory infections. It definitely has to encompass a much more sustained and integrated effort on chronic diseases. We talk a lot about hypertension, diabetes, and hypercholesterolemia. And indeed, those are big ones. But we also have to remember there's heart failure, asthma, chronic lung disease, other chronic diseases which also create a lot of morbidity for our patients, where there are many opportunities for us to manage and control conditions better so that patients have a much higher quality of life and don't have to use hospitals as much. So certainly that has to be a focus of how our GP colleagues can help us in the health system. But going beyond that, there is also this really important element of preventative care. And whether it is advice about sleep, smoking cessation, exercise, diet, the doctors, primary care physicians play a critical role because you are trusted partners of many families and patients. And therefore, the primary care sector, the GP sector, can play even more in helping us to push through the messages of preventative care and to help our patients to better achieve them. And this extends into things which are currently very topical, such as vaccinations. In this case, vaccinations also for influenza, as well as for pneumococcal pneumonia. Finally, as we think about the way our demographics are changing in Singapore, we will have many older people. Our goal is to help them age well in place. This requires really for a stronger support within their homes and community. Some of it will be healthcare, some of it will be social services, some of it will be community types of support. And in this regard, I think GPs in particular can play a really important role, but working closely with the other providers, the other support systems in the community that would be required to help people to age well in place. So this, I think, is the essence of population health. I think there is a great deal of opportunity for us to broaden and in several ways deepen the scope of what GPs can do within a well-integrated primary care system. And that, I think, will be perhaps the single most important aspect if we are going to meet our population health goals. Thank you.
Thank you, Prof. Tan.
Thank you, Prof.
Dr. Tam, what do you think in terms of from a GP perspective, what do you think the GP should do to step up beyond clinical care?
Thanks for the question. I do want to echo what Prof. Tan has just said with regard to preventive care. I feel that this is an area that is relatively neglected in the GP sector due to various reasons, whether it's due to the episodic mode of consultations, as well as the business model, which is typically based on fee-for-service in the context of Singapore, unlike, say, in the public polyclinics, whereby they have a slightly different way of funding healthcare services delivery. So I think preventive care is a very big word. Okay, it encompasses a lot of activities ranging from health promotion, risk identification, health screening, vaccinations, etc., even including patient empowerment and engagement. And obviously, this is something that traditionally is not what the GP can afford to provide in terms of time and space. But moving forward in the context of population health, I do think this is of extreme importance. We want to improve disease outcomes, we want to prevent disease, and we want to prevent complications. And I think it's exciting when, in the words of D.S. Ewing, if we can merge health models together with technology, whereby we can get extra help to manage a pool of patients, not just from a disease perspective, but from a preventive care perspective. Another area which I think is relatively untapped, which I think is important for the GPs to really seriously look into, is in the area of mental wellness. I think this issue has taken on a new significance in recent times, and we are now gradually recognizing the importance of mental well-being, not just among people who have no diseases, but even among patients who have diseases, and of course the impact on their family members. And this is something that, again, I think with the use of technology tools, with the use of reworking of workflows, we can potentially take care of these patients concurrently with the rest of the case mix that we are exposed to. Last but not least, I think GPs need to evolve into a care model whereby they cannot just look at the clinical aspects of medical conditions. They need to integrate these with social, family, as well as work-related factors. This is an area which I think has tremendous implications for the patients and their family, because obviously family medicine and primary care, the strength is really in a good doctor-patient relationship as well as holistic care. We take care of individuals, we don't take care of organ systems. And you can't possibly take care of a person if you don't take into consideration what are some of the issues at home, what are the social considerations, what are the work-related factors, some of which will probably affect the outcomes of the diseases that they are having, or affect the kind of risk that they may get in terms of chronic diseases. And again, I think if we are looking in the context of population health, where we are going to share care with other healthcare providers in the sector, this gives us opportunities to see how we can cement our role in helping the patient navigate through the healthcare system, take care of them from various aspects, okay, marrying this with technological tools, analytics, actionable insights to help us manage these patients. That also means that the GP needs to get out of his or her comfort zone. He must be prepared to interact with maybe other healthcare providers in various touch points, and also be prepared to interact with the patients as and when is needed, okay, using a variety of care models that is suited for the community at that point in time. Yeah. Thank you.
Thank you, Dr. Tam. Yeah, indeed, I agree. GP is going to play a really critical role in in this population health as a family doctor. And I also agree that mental wellness really is one of the areas that we should not neglect, and is increasingly become very, very important. And I certainly agree that GPs will play a very key role there as well. In our last few minutes, I think we have one more. I think we can probably take one more question. This question is interesting. Likely we'll hear from our panelists. The question is, since the government is encouraging partnership with GPs, why is MOH still building more polyclinics with the aim to have 32 by 2030? Maybe perhaps PS, you'd like to take a shot at this, and then we can hear from the rest of panelists as well. Yep.
Right. Thank you. Actually, even with 32 polyclinics, we don't have enough, and we will still need more GPs as well. So as colleagues are aware, we are hoping to right-side a lot of the care. Today, our SOCs, for example, in the hospitals, the public healthcare institutions, the specialist clinics, a lot of cases are seen down there, chronic disease management, that is actually much better managed at the primary care level. So whether it's primary care level at the GPs or primary care level at the polyclinics, what the ministry has done over the years is to bring in GPs as a partner. So we started off with CHA's clinics, for example. I think COVID actually, in fact, illustrates very well the way how we have been trying to bring in the primary care partners, GPs. So without the PHPC clinics, the public health pandemic clinics and the C.H.A.T clinics, we call them fever clinics earlier on, the clinics that help us do the swab and send home as well. We could never have been able to manage a large part of the COVID operations that we have. Even today, for vaccinations, many of the elderly in particular, they prefer to go to their nearest GP rather than to go to a vaccination center, which is, in our view, actually vaccination centers are very efficient because you can do more than 10,000 a day. But we still rely on network of PHPC clinics. These are the GPs because they reach out to the individuals very much better. So the way I look at it, for the foreseeable future, the GPs will continue to be an important partner. We still need polyclinics because the overall demand from an aging population, as well as the move to right-side care, to primary care, continues to be important. So it's going to be a partnership, and I don't envisage that there's not enough business now. Thank you.
Thanks, BS. Yeah, indeed, I think it sounded like more like a dual engine that we need both to continue to. But perhaps, Dr. Tam, you have any views on this as well?
Thanks, PS, for his input on that, and I agree wholeheartedly. I think in the context of population health, the healthcare challenges that our country is facing in terms of aging population, rising chronic diseases, for example, I think we should look at the primary care sector as one primary care, rather trying to draw lines between the polyclinics and the GPs. What I think is important is that we must clarify and be clear about what the GPs could do, and where opportunities and the potential present itself, we should try and uplift, resource the GPs to do more than what they are doing right now. So it's really not a question about whether there are more polyclinics or more GP clinics. I want to reinforce that we should really progress and work towards the one primary care concept. Thank you.
Thank you, Dr. Tam. Yeah, I was told that we still have a bit of time, so I'll go to one more question, which I think is also related to what you just spoke about. The question is, how do we ensure that the incentives across the healthcare continuum, both hospitals, community health, GPs, telemedicine providers, are aligned to support population health, given some new models such as remote care will disrupt a lot of the existing value streams? I'd like to invite Prof. Tan, because I think Prof. Tan spoke a bit about financing alignment as well. Prof. Tan, do you have any views on this particular question?
Yeah, I think it's a very important question. The first element of it, I think, is being clear about the overall objectives. As we develop population health further, what are the major outcomes that we would want to achieve? How would we track progress towards them? And having that clarity at the level of doctors, care teams, public health officials as to how we are moving. I think that would be a really critical piece, and that information, that data about progress can also be used as a way for us to adjust our care models, our approaches, so as to be able to reach out to more patients and to be able to achieve the goals that we have set out. So just to link back to the earlier question on polyclinics and the expansion of primary care, one really important piece about population health is not just to help manage those patients who are current already users of the healthcare system, but those who ought to be using the health system but are not. So if you look at some of our chronic diseases like diabetes and hypertension, somewhere between a third to half of patients who would benefit from having these conditions well managed are not regularly being seen in the health system. And therefore, we do need to diagnose such patients, reach out to them, recover them from being lost to follow-up, help work with them in order to achieve the level of chronic disease management that would enable them to keep healthy and to prevent chronic diseases from becoming worse. So one part of it really is about clarity on the goals as well as data to track our progress. And the second part, I think, which is really linked to this is the issue of financing. And there I feel that the key shifts that would be very helpful, firstly, are that we move away from financing that incentivizes volume of procedures and attendances, that looks more at the outcomes. So, for example, if financing is provided in a way that helps doctors, whether they're GPs or hospital doctors, to try to get the best outcome for the patient over a long period of time, and not just for a particular episode when the patient is in hospital. One classic example is asthma. Our goal for asthma should be to have patients with asthma well managed in primary care, able to function normally because of the use of preventor medication, and not just to be able to treat them well when they turn up at the A&E with a very severe attack of asthma. In some ways, if they do that, it's a failure of preventative care. So we need to look at financing models that don't just incentivize volume of treatments, but also the longer term outcomes that we would like to have, including the preventative aspects of it. Then we also have to look at whether the financing enables the right siting of care. So this requires us to look at the financing gradients between different parts of the health system, whether they are outpatient clinics in hospitals, attendances in polyclinics versus GPs. The out-of-pocket element can help shape patient choices and behavior, and therefore we have to look carefully at financing in order to advance preventative care, but also to create the right alignment of incentives across patients, providers, and the people who ultimately pay for the use of the system. So I would say those are some of the key elements that would be really important for us to move in the direction that we would like to move. Thank you.
Thank you, Prof. Tan. Yeah, indeed. I think this is a bit like the team sport that Siu Ying talked about as well, right? You reward the entire team. You don't just reward only the striker who scores the most goal. You actually also reward the goalkeeper and the defenders for preventing goals from being scored by the opponents. And in this case, I also think that even the patient themselves, if we incentivize them, they will also then take health in their own charge and actually also hopefully change the behavior. I'm afraid we have come to the end of the session. A big thank you to the panelists for their meaningful insights and also very diverse perspective. I hope we all learn a thing or two and get to have a better understanding of Singapore's population health journey and plans. Thank you very much. Thank you for joining us.